Hello, everybody. Today, I am so excited to have Dana Starling back on. She is the founder of Starling Structural Therapy. She helps people of all ages with chronic pain, and she does it from the privacy of your own home. But you have to reach out first to make sure that she's the right person for you. And if she is, she can make miracles happen. Welcome back, Dana. Tell us a little bit about yourself before we get right into it.
Uh, Background story, I've been in the working with chronic pain populations for 26 years. I've had my own practice for 15 years. We specialize in chronic pain conditions, a multitude of chronic pain conditions, from orthopedic to neurological, of course, all the idiopathic, right? Um, all the way from plantar fasciitis to TMJ to headaches, right? So we don't discriminate. We work on the entire body. The program is virtual, and we offer a free 45-minute virtual assessment. Um, this is our way of testing to see if someone's a physical candidate for treatment. If they are a physical candidate for treatment, it's very, very obvious to them and to us because we can usually instantly drop their pain. The normative pattern is 50+% in that consult. Doesn't mean it's going to stay down. It means this is a viable form of treatment for you. And if not, we make sure they walk out the door with good recommendations based on what we're seeing, so that way you're walking out better than walking in no matter what, right? So that's what we focus on, and the program is all virtual. Okay, so as you mentioned, it can be done. We have clients all over the world. It's really cool.
Touch so
Okay.
many people that way. So
Yes.
today, what we're going to really focus on is tongue ties. This is such an important thing. Mac and I just did a podcast about how the tongue helps develop the face. But I need to know from a fascia point because this is your expertise, this is your world. What is going on when somebody, be it an infant, child, or adult, has a tongue tie? What happened?
Okay. So I'm going to start. I like to tell stories. I'm going to start with a little bit of a story. Okay. Which is why I actually reached out to you. I'm like, we need to talk about tongue tie. Okay. Early on in my career, I was working for my mentor, and I walked up to her maybe year one, and I'm like, everyone's coming in with the same, almost the same thing. Like a lot of people coming in and telling me, and at the time that one was piriformis syndrome. And I'm like, it's not my brain. I'm very logical. I had no idea it was brand new. I was like, this doesn't make sense. Like they're all like, even if the symptoms are around, they're all being given. She goes, get used to it. In our industry, she said, it is syndrome du jour. Now, in my world, people with chronic pain, they show up usually with one area that really bothers them. Let's say they have, right, jaw pain, right? But they usually, if they have jaw pain, if I ask some more, they have back pain, they have neck pain, they have shoulder pain, they have headaches. Okay. Started to look a little bit more into research. And I will tell one anecdote when I ran into one practitioner, which is another alarm bell for me, that told me that she did, that's basically what she specialized in. Okay. And started to ask me about the correlation with tongue tie and fascia. And I was trying to understand where she was coming from. So I said, okay, just and she was working with babies. And I was seeing adults were coming to me, right? So now I'm like, okay, what's going on here? Now babies are also, and the adults, and she said that they bring infants to her specifically that are having issue with breastfeeding. And I asked her a simple question to try to understand. I said, okay, out of 100 kids, how many do you perform tongue tie on? Would you like to know the response she gave me?
What?
All of them. All of them.
It
Every
is
single one.
very
All of them.
Wow.
It is
All
very
of them.
prevalent right now. We're seeing it like
Never
I'm
I would
seen that.
sorry.
say
I
70% of the population right now.
listen.
Mm.
I was like, alarm bells are like right now it's red flag on fire, right? Like,
Yeah.
okay, I'm
But
sorry.
that's too many. That can't be right.
It cannot be right. And then she named over 5,000 that she's done.
Wow. Okay.
Now, we've all heard of the sentence, right? If all you have is a hammer,
Right. But
okay,
knowing you,
but
you
it's
dug
not.
deeper, and what did you find?
Right. So I was like, okay, hold on. Right. So I'm going to briefly read from this article, okay, which was also quoted in the Harvard Medical School, okay, and it's from JAMA. And I'm going to just give you the findings. So we've got just a brief overview. The findings is that out of 115 infants, remember my question when I asked her out of 100
Mm.
babies, right? Because I'm thinking that's a relative N number, right? Yeah, out of 115 infants referred to frenectomy, tongue tie, evaluates a program of feeding examination by pediatric speech and language pathologist. 72 of them, which is 62% of the infants in the program, were not recommended for the procedure. Okay.
Okay.
So 62% of infants, they found this could be solved by interdisciplinary without cutting, first of all, also. Okay. You just look it up. Yeah. Um, this one, I pulled it up. This is in a magazine specifically for parents. Okay. But it is basically, okay, about 8% of babies are estimated to be born with tongue tie. Okay. Like, think about that for a second. Okay. By the way, this is from the American Academy of Pediatrics, to be very clear. Okay. And they are basically saying that there is, guess what? Massive overdiagnosis. Okay.
Dana, Dana, I'm going to have to completely disagree with both of those articles. I think that people do not know what to look for at all. 8%, I mean, I'm just a gen dent, okay? But I can tell you, there's a reason why. It's like the question is not, are you going to need orthodontic treatment anymore? It's when are you going to need orthodontic treatment and how many times have you done it? Because no one's diagnosing things correctly.
I
And
agree with that.
typically, it's if the tongue's not on the roof of the mouth, either because of mouth breathing or a physical restraint or obstacle, that tongue will never get to be where it needs to be. And so they'll need orthodontic treatment, or once they have it, they will relapse. Percentages suck, and research is
Oh,
often antiquated, in my opinion.
the 8%, in my opinion, is not accurate. Okay. I think what they're saying in that 8% is that is unequivocal, like they show a thickening. That's what they wrote. Okay. All they're saying is they're seeing a massive overdiagnosis and therefore overtreatment.
And it's been in the media uh, about being overdiagnosed and overtreatment, and it just is a moneymaker.
It
So
is. And
the problem is like anything TMD, fascia, what you're doing, what all of us are doing, that nobody, the lay public doesn't know, the MDs don't know. And so it's mass confusion, which is one of the reasons we have this podcast, is to shed some light on the subject.
Mhm.
So please go on.
So it says actually, I would like to hear from Dr. Marsvan a little bit more. So do you, if 60, let's say babies, right? Because there's two categories, right?
Mhm.
Babies are one category. They said when it comes to the breastfeeding part, right? The function, right? Now, I'm not talking now about your realm, which is like the tongue literally affects the development of the shape of the face, the mouth, everything, right? Do you think the ballpark of roughly 50%, it was 62% that didn't need it, that are overdiagnosed, do you think that might be accurate in that situation?
I do, but I want to say I'm not an obstetrician, so I'm not saying just babies all day, every day. When I'm seeing babies in our office or children, they're coming because they already have a problem. So if I was going to take my patient population, I'd say 98% of them do, but I don't think that's very honest or realistic. That's what just comes in my door. It's just what I'm seeing is the fact that so many Americans, at least, need orthodontic treatment. Um, and it has to be done over and over again. There's relapse, relapse, relapse. And then
So let me understand, because it's clearly outside my realm. Are you suggesting there's a correlation that if they got tongue tie, they would not need orthopedic? I'm trying to understand the correlation.
if the tongue had good range of motion and it can actually elevate and sit on the palate, there's a great chance they may not need any orthodontic treatment at all. There's always the genetic component that we have to keep in mind. But if you look at our ancestors, I mean, anthropologists understand this better than MDs and DDSs and, excuse me, fascia experts may as well. But we know that our ancestors had space for all 32 teeth plus a centimeter, which is the size of your thumb, behind the wisdom teeth. Why is it that our jaws are shrinking? One of them is because of our diets and all the crap in the air creating pollutants so we can't breathe through our nose. The other is the anatomical restriction that's under the tongue. And so I constantly talk to lactation consultants in my area because we try to collaborate. I talk to ENTs and I'm like, why do we think that this is becoming so prevalent? And there's a thought, and I don't know if there how much legitimacy this is to it, but they're thinking that some of it's from what's in our prenatals and the extra folic acid that's causing the tissue, the fascia to react in some way. Because, back in the day, in the, you would have these midwives, if you will, that actually saw it and they just used their fingernails to cut underneath the
I
tongue.
read it. For me, is it okay if I show an image, one image?
Sure. Go for it.
Okay, so for those, and I recommend go check this podcast on YouTube for this specific reason. So this is an image, okay,
Okay.
of one of the fascial lines, okay? In fact, it's called the deep front line. And the reason it's called deep, it's because you need to reflect an insane amount of tissue to dissect it off in order to see this. This is like on the inside of the body. And that connects to the visceral tube and the tongue.
Mhm.
Okay. So I am assuming that that it probably started with, as I tried to trace it, it seemed like the tongue tie procedures started specifically for babies more.
Yes.
Okay.
Yep.
And now I'm seeing it like everyone's being told it's going to cure their neck pain, their back pain, their headaches, and I'm like, okay. So basically, this connects all the way from the foot through the inner thigh, through the psoas, through the mediastinal fascia, like the lungs, heart fascia, okay, up into the visceral tube and even into the jaw, if you can look here, okay. That to say, that this is a giant continuous line, right? A human being is the system of systems.
I agree with what you're saying. I just want you to maybe hear something you haven't heard before or a different
Hmm.
perspective. You started this by saying not one procedure, not one modality is going to fix a chronic pain
Correct.
patient because there's so many systems that have gone awry, right? I will tell you this, and when we do tongue releases on adults for the chronic pain patient, okay? I've been doing this for almost 2 decades at this point with different types of lasers. I will tell you this. Patients have told me in the chair that they can breathe better through their nose instantaneously. Sometimes it's one nostril, sometimes it's both nostrils. Sometimes there's no difference at all. I can tell you when they stand up, I've had patients cry. I'm not joking. This is not like snake oil and tonic.
Have you ever heard about the surgery, the mock surgery tests when they do just an incision versus the surgery placebo effect?
So that could be part of it,
Could
but
be,
I
could
get
be. I mean, by the way, it could
patients.
also be with my treatment. It could be placebo. Placebo is always a possibility, right?
Yes,
That's
yes, there's always
For
that.
all of
There's
them.
also
all of
the
that,
care and
literally
attention
everything.
you give patients and, making them feel supported and seen. But
Don't
anatomy,
underestimate that.
Dana, anatomy is anatomy. And I don't see these patients once and never see them again. They're in my office for usually 2 years-ish, and then they come back annually for me to see, and they're working with different body workers. So the fact that some, not all, their range of motion improves, their gait improves, their pain dissipates, they can breathe better. I'm talking little kids that you don't even prompt, that we've done tongue releases, have told their siblings, oh my gosh, since I had my tongue release, I can stand straighter or I can sleep better. And aside from that, we use rhinomanometry to measure their airflow through their nose and like before and after treatment. And there's a lot of variables in it. Like maybe the next time they come in, they had a cleaner nose. Maybe the time they came in, they were slightly congested. But what I'm seeing over and over again, because I'm trying to get measurable data, not just anecdotal, and anecdotal is just as important as
It
measuring
is. It
data
is.
because
It
how
can
you
build up to
feel is
data.
important as science. But we're seeing that their airflow, the resistance starts to drop and their airflow improves over and over and over again. So there is some structural component to this, and I'm hoping you can tell me
Of
like
course, there's.
why is
If you
it?
cut me here, if you cut me anywhere, there is a structural component. Okay. My whole thing is taking one tiny little spot and
Mhm,
thinking that is going to be anything that sounds like a panacea, I
mhm.
get alarm bells on.
Agreed.
Okay. You didn't describe panacea, you described multidisciplinary treatment and a lot of care for the patient. that is a good way to go. It's if someone's in a practice where this is what they're doing to every single person that walks in the door, panacea, I have a problem. I have a problem.
Sure.
Right? Here's the thing. There's bad fascia work, like, right? There's bad everything out there. Does that make sense? I would say buyer beware, meaning if all that person does is that procedure, like in and out, right? Do you know what I mean? No before, no a lot of treatment before, not a lot of treatment other, no multidisciplinary,
So with
and promising them that, be careful.
so
So
with
let's go back in history from a common sense standpoint. I'm agreeing with what everybody else is saying, but my wife had the choice of breastfeeding or not breastfeeding. Back then, nobody had a choice. And so if the baby couldn't latch, the baby was going to die. So through experimental things, they did everything in the world to make that
Wow.
child survive, and that's how they got the tongue cutting. That's one thing. That's
Interesting.
just because they could latch. It's not because of all this stuff that we're talking about, that this is connected to that and that's connected to that, just to survive. That one thing. But that one thing freed up the tongue to do its thing, which allowed more expansion of the jaws, more breathing, more et cetera, and more et cetera. When you bring in fascia on this, is the fact that the fascia is connected from the tongue all the way down. Well, then we've got way too many things to talk about because it is
But you have a valid
fascinating.
point. When it was created, it was right. There was no baby formula. You're right. Like you
No.
latch or we have problems, right? That's a very valid point, right? As to the
There was
inception,
no
the
there's no
discovery.
science. There's no science back then. You just got to put yourself back then. What would you do if your baby couldn't
my
Hmm.
suck?
my yeah, my biggest concern with all this, and you guys asked me to interrupt us so we can have time to talk about scoliosis, and we're right
Yes,
out there. My biggest concern, Dan, I think you're a little worried that people
I
are
am.
overboard and not correctly diagnosing and sometimes even doing the wrong procedure that may not be necessary.
Harm is minimal too. Like honestly, let's be honest, right? It's so minimal. Like I'm
It
not.
It can be and it can't be. My biggest concern is um, if the baby, if an infant's diagnosed correctly, you can stop so many of the systems for going the wrong direction by doing the tongue release. Because when that infant's small and their face is developing, so much of that face is developed by the age of 4. And if the tongue's not where it needs to be, they're going to have all kinds of structural changes in the wrong direction. They're going to grow in the wrong direction in every way growing up, period. That's irrefutable, in my opinion.
Mhm.
But when they are toddlers and it's too late, and or children or adolescent or adults, and people are doing tongue releases without understanding anatomy, if you release a tongue and the jaw is too small for it, you can actually exacerbate a sleep issue and make it worse because it can fall back. And if they're not doing tests, strengthening or release mechanisms to tone up that tongue because it is a muscle, that's a big issue, and I think that's being not addressed or looked at appropriately. That's my biggest red flag right
So
now.
that like I want to put that on like right. So that's the perspective I was looking at for from you guys, right? Because again, as I told you, I deal with adults. People do not bring me babies, right? Thank the Lord, babies are not in my category of chronic pain. Okay, but that was my thing of like this is and then by the way again in my realm it's minimally invasive,
It
okay. I
is.
have seen my share of also this is the surgery du jour, yes, but to your point, if it's the wrong practitioner, if it's not testing before, care after, if it's all of, not only might it not just be like unnecessary and costly, right? To your point, there may actually be detriment, which for me, I wasn't even thinking about that because I didn't know enough about the structures here to say this. For me, it was more careful. It's money making machine of promising you that your neck and your shoulders are magically going to go away. And to your point, on top of that, they may actually be causing structural issues at the jaw, at the tongue, if not properly followed up and diagnosed also
Yeah,
before,
and not
right?
just by me, but by body workers, whether it's PT, chiros, whomever, just to get them to function and start utilizing things correctly the way they might not happen.
But and I'll say one other thing regarding that. That is almost true for any, I would say, surgical intervention. That it goes in and fixes usually one small piece, okay? Maybe sometimes larger, like a spine fusion, right? But then there's the rest of the body around that that has adapted before, that will adapt after. And
Mhm.
to your point, there's got to be good prep to it and then aftercare, multidisciplinary, ideally. Yes.
Great.
So when it comes to treating pain, the head is the roof of the building. Okay. If someone, this will lead us very nicely from frenectomy to scoliosis. Okay. If someone has an issue at the top of the building, meaning their head and their neck area, we work them from their feet and their knees and their pelvis and the spine, and then here, right? And sometimes we get people from dentists, which is lovely because I know this is already being treated, and my job is to balance out everything underneath it
Mhm.
and we're good. So then it's not just temporary relief, or it's structural work. It's almost like if you walk by a building, okay, and you see that the roof is sliding in an interesting angle, right? Do you start to fix the roof?
Hmm.
Or do you maybe check the foundations and then the first floor and the second floor and then the roof? Yes, right. I don't hire the architect that starts to fix from the roof. Right now, a human being is not just a house. Yes. So I like treating from, if you can control the feet, control the head, the rest of the body will balance out. It's quite magical. Okay. But that would be the way to go about it. Okay. Treat, if it's a system issue, treat it like a system, not myopically, if that makes sense. Okay. So someone comes to me with low back pain. By the time they come to me, how many treatments have they had for their low back? Too
Tons.
many to count. Sometimes they'll write and they're like, I didn't write everything. I'm like, I hear you. Okay. Now, do you think I'm going to go and try to treat their low back again?
Mm. No.
No, we have a lot of evidence that that myopic treatment right there did not work. I've got to look at the rest of their system, see if I go after it that way, will it help it? And if I do the test and they get 50%, usually 50+% drop in symptoms, I know this is the correct approach for them.
Hmm.
Hmm.
So it's
And
interesting.
that's a nice way too. So it's not like, hey there, ho there, hi there, like come do this. I'm going to test to see, is this something you should invest in? And not just money, to be honest, right? Hope, okay, time, energy, all of the above. Okay. Yeah. So I'm going to segue to scoliosis from this, right? So for those, right, scoliosis is just a fancy Latin term for lateral curvature of the spine. It means the spine is curving sideways, kind of like snake sideways or a zigzag type sideways, as opposed to the normal, more front to back. By the way, normal, air quotes, what the heck is normal? Okay. But um, in the sagittal plane, right, we're supposed to have the kind of inward curve in the low back, a little bit of an outward kyphosis in the upper back, again, inward curve at the back of the neck. Okay. So those curves are the air quotes normal. Okay. Scoliosis is a deviation to the side, that it bends to the side.
Mhm.
And immediately you're dealing with more vectors of force through the entire body, not just through the spine. That could result in hip issues, in knee issues, in foot issues. It could, all of this and that. Now, here's what I like to tell people when they come to see us for scoliosis. If you want me to, air quotes, fix your scoliosis, meaning that your x-ray will look different, no, I'm not. And again, maybe in 20 years, maybe that, but no, that I can't. Look, I have a scoliosis. So I have deformed vertebra and deformed ribs. I cannot fix deformed vertebra and deformed ribs, but I can sure as heck rehab the soft tissues, myofascia, muscle and fascia around it. And the fact that I've got that deformity does not mean I need to live with pain and limitation. Like absolutely not. That's the part that we do offer people, right? If you want me to fix your x-ray, no. Okay. But if you want me to give you a better quality of life and have like everything open up for you so that you can go see your kid at the baseball game and sit on that crappy bleacher without like, being down for the count for 2 days, right? Those kind of things, like just participate in life, right? Go for a hike. Yes,
Yeah.
play tennis, all of the rotation sports. It's completely doable. Scoliosis is I have seen people that, I mean, their x-ray is like this, okay? It's a very high degree of scoliosis. It's amazing how they can get out of pain and stay out of pain if they do the right stuff, okay? So very, very, very effective. There is the objective measure of someone taking your x-ray and measuring the angles, right?
Mhm.
It cannot affect the objective. I cannot undeform the bones. Now, your subjective experience in life, how you feel,
Mhm.
less pain, eventually no pain, and then freedom of activity and movement. Yeah, we can definitely affect that massively. Okay. I
So
did a lecture at the biggest neurological hospital in Arizona, and it was specifically on scoliosis. And they had this kid, she was post multi-level spine fusion. And I did two little things for her feet, and being dropped like that. I mean, it was insane. Okay. So it's so doable. Okay. And I've had people with scoliosis in their 70s and 80s, and it's doable. So sorry.
when you
That
treat
clearly I'm excited about this.
I love that you're excited. That's why, we're part of the same tribe here. So when you treat those people, because fascia to me is something almost fluid, there's no hard stop other than your 2 feet touching the ground, like you say. So when you see chronic pain patients, it's from years of doing either damage because of a trauma or just damage because of function, like improper function. So
Mhm.
you are releasing or they're also teaching patients essentially how to change their routines of life so that they can have an improved quality of life, right?
So
What's your follow-up?
I could have given you $20 to say that, to ask me that, right? So that was a perfect question, because the way the treatment works and why I believe, right? I mean, we've got like, I don't know, 75 Google reviews. Like, go, don't listen to me. I'm biased, right? Listen to them. And I recommend for people to also read the long ones, because they'll tell you they're more honest. They're not going to be like, oh my God, I'm so great, which it's lovely, but this is the work it took to get there. Okay. So there's two things we need to work on when it comes to connective tissue. One, this is what we test at the consult. There's the acute relief of chronic pain. We have these, we call them homework exercises because, for lack of a better description, they take 3 to 5 minutes, and they'll give you control yourself, the patient, the client themselves, to instantly drop their pain 50, 75, 95 by the time you design it. Okay.
And is this
Yeah.
something they
So
have to do pretty much indefinitely almost?
So thank you. Thank you. So what I like to tell everybody, and that leads to the other part, you're not stuck with us for life. Thank God. Okay. I mean, I have clients who've been with me for 15 years. Okay. But right, they come see me for the biannual, but no, you're not stuck with us for life. Okay. But what we're teaching you is conservatively, if you've had pain for 10 years, it's conservatively for 15 years. Okay. And if you have a scoliosis, for instance, meaning a structural, it's for life.
Right?
Okay, now let me explain it for life. So there's the homework part, that's instant drop of pain. Then there's the other part, which you asked me about. So there's a property of fascia called piezoelectric. Piezoelectric is bone is piezoelectric. We all know if you weight bear more, right, more strength training, you load bone more, it builds more. Okay, connective tissue has that piezoelectric property. It remodels based on how you load in gravity. Okay,
Mhm.
so it will not change as quickly. Muscle changes quicker via exercise and onto the bone. Connective tissue takes a little bit longer. Okay. So I can give you the best homework in the world. I can give you 100% drop in symptoms. But if I leave you compensating and walking and sitting and working and sleeping all scrunched up in that compensatory pattern, either on top of trauma or on top of function or on top of some kind of congenital issue, right? Nothing's going to hold. So the other part of our treatment, it's not complicated, but it is not easy. We need to change, first of all, the three things you do the most in a 24-hour period of time, because you're in gravity even when you're sleeping, right? Unless you're in outer space, you're in gravity. So first thing, I need to change your sleep pattern, because you're doing it every single day, 6 to 8 hours, somewhere like that, static. Okay. After that, depends on the person, right? But usually sitting. So usually sitting to work. Then sitting on the couch, Netflix, whatever, because oh my God, right? The couches are job security for me. Okay. And then after those three with the homework, life gets so much better once we get those. It takes about 6 sessions to get that. Okay. Like I tell people, if you don't do everything I ask you to pause temporarily, and you do everything I tell you by session 6, you should have a very different life. Okay. Now it's not done yet because we're working through lifetime or 5 years or 10 years or 20 years of habit, right? But that's the point. How much do you want from me? Do you want to learn how to load the dishwasher without hurting yourself? Because I can show you that not only not hurt yourself, but benefit from it. Remodel your fascia, right? Once you learn this, you're doing fascia therapy when you're sleeping, working, loading the dishwasher, petting the dog.
So
Okay.
say like myofunctional therapy is fascial therapy in that way?
So myofascial, so the diff here are the I would say the two biggest differences between regular myofascial therapy and, for instance, what we offer. One is very obvious. We work, as we said, virtually via Zoom. We never touch you.
Mhm.
Okay. So it's truly teach a man, teach a woman to fish, not give a woman a fish. Okay. So there's giving you the tools that way, but also there is no passive element. Okay. That means it's not being done unto you manually. So all about us teaching you. So that's one thing. Here's the other part. The other part of the treatment, the bulk of the treatment, is that lifestyle modification, teaching you how to do those things. And that is very rarely, rarely taught. Sometimes I'll teach you how to stand for a second, but that's about it.
Mhm.
Okay. A human being that does well is dynamic equilibrium because you need to not fall. That's the equilibrium part because we're bipedal, right? But dynamic, you're constant. The minute I reach for my coffee, it changed from when I was standing here just facing you, right? So just teaching me how to stand and, putting me back in the box, shrink wrap me in mint condition, that's not going to work. Okay. So we add that component, which again, it's not for everybody. Okay. So when we actually test people at the consult, the first test is physical. Are you a physical candidate? And then I vet, are they an emotional, mental? Because they're also that. They're a human being. Are they a mental, emotional, like candidate for treatment?
Right.
Okay. Hmm.
It's funny, treating TMJ patients, chronic adult patients, um, we talk a lot about structural changes. And I love the fact you say that because some of my patients come in with clicking, popping, and jaw locking, which is extremely painful when they actually lock out. And before I treat, part of our intake is to do a 3D, the CT scan. And, sometimes I'll see, we always talk about a ball and socket, like that's what a joints look like and how mangled up these joints can eventually be with flattening, beaking, rotational changes. And so, when someone comes to
Good
me
question.
with severe pain, or locking issues as well, I'm like, okay, my phase one treatment is to see if I can get your function and quality of life back. Now, looking at your joint, there's been deformation that's there, and I'm not fixing that. I just want to make sure you have good range of motion, no locking, and no pain in your
Hmm.
joint. But will you never click again? No. It's like if you have really nasty arthritic changes in your hips, you know, will you ever be a marathon runner again? I hope not. But I can get you to,
You
do
can get them to run if they
5K.
ran before, but
You can do 5Ks, you can dance and you can walk, but would I recommend that? Probably not. And maybe over 5, 10 years, theoretically, the bone, if I exclude that space, it should remodel and agree,
yes,
right? But I've
yes,
had a CT for 13 years and I don't always get my patients back because they're doing well to be able to say this is happening. But I tell them theoretically it can, but for me, if I can get their jaws functioning well, so
quality of life.
it helps, but it doesn't stop there. They need to work with somebody who understands fascia, muscles, posture, because so many things already gone wrong. And if that's what they want to, go for at this point, improve that part of their life, that's a forever work in progress, like you're saying.
So the way I also tell them, like, again, in the beginning, we need our clients to do homework. By the way, the homework literally is 3 to 5 minutes, instant pain relief. So I tell people, like, in the beginning, everybody does their homework. Everybody does, because it's like instant. Someone said it's like instant Vicodin, but it's not hurting the rest of me. I'm like, oh, there you go. Okay.
Right.
Now, then comes the problem of when they feel really good.
Sure.
Uh-huh. Yeah.
Yeah.
And that's the part. So what I tell them long term, they need to do the homework long term. Okay. Once they're really stable, living in what we call zeros on a scale of 0 to 10. Okay. Meaning no pain, 99% of the time, not even sensation. Okay. They need to do their homework twice per day, specifically in the morning and night, which there's a reason for. Okay. 6 minutes. Now, they still have to sleep the correct way, sit the correct way, like that stuff that doesn't go away.
Right. It's like
Okay.
eating well.
It is. You're
Right.
right. Right. If I want my blood sugar in the right place, my cholesterol and my weight, right, and I eat a certain way, once I get to that weight, do I go back to donuts expecting to keep the result? No.
Right.
So, do the two of you have the experience of taking patients that have life-robbing pain and they come to you, they're crying, they've been to everybody in the world, and Pam does what she does, I do what I do, you do what you do, and their pain goes away and they forget they ever had that
Sure.
pain.
Yeah.
That's a very, I mean, here are the three of us, you're in Arizona, Pam's in Washington, I'm in Texas, and it's the same.
Yeah.
So
And you
here's
know
the thing.
what's,
Here's the thing.
yes,
And Pam and I were in Japan at a meeting where there were dentists all over the world talking about what Pam and I do. And it was the same. And their patients were the same. Spoke different languages, different cultures, but everything was the same. So we all need to get together, the people who, like the three of us and other people who do the same thing, the chiropractors and stuff, and come up with some answers. And we're not that far away if we could just stop and talk to one another, get the ego out of the way,
Mhm.
and start listening to one another because we could teach you something and Pam can teach me something. I can teach her. So we all can teach each other something because we're making this podcast for the people in
bless
pain.
you.
Bless you. For people in pain and they need help. And so we all need to get egos out of the way and to start listening to one another.
Agreed.
And I like to stay in my lane. Like if someone comes to me for
Absolutely.
TMJ, I'm like, are you seeing someone that's really taking, and if not, which state are you in? I know some people, right?
Yeah.
Yeah.
Exactly.
Yeah. Like I don't want to teach someone, like, as I said, I understand syndrome du jour. I saw some patterns. I told you I had to Google tongue tie. I had no idea what it was.
Well,
So
as we wrap it up here, guys, because we could probably talk forever. I know
Yeah.
we can, and I would love that. We're all such nerds and passionate people. Something I want all of our listeners and viewers to understand is if you guys are, I guess, centenarians in the making and you're trying to live well, all of this has so much relevance to it. Because I don't think that anybody, as we get older, we have just this one vehicle and we're constantly abusing it. We have certain patterns that we're completely unaware of. And yes, there are structural hard tissue things that I can work with, like joints and teeth. But as adults, your chronic misalignment, be it your jaw, your posture, whatever, that's where people like Dana is somebody that I think you could benefit from because she's going to teach you how to use your body correctly so you can do all those activities as simple as loading the dishwasher or playing tennis. So if you want to find her, she has a lot of amazing content on YouTube. Look under Sterling Structural Therapy, and she can also be found in Arizona. What's your website again? That's
Sterlingstructuraltherapy.com.
easy. And I
Yep.
want to thank you again for coming back
Thank you.
because this is our second time. She's our only guest that we've invited to come second time. Because again, I feel like we can probably do another podcast and get into it even deeper. So thank you, Dana, for your time.
I'm here for it, and thank you. And I learned a whole bunch. I appreciate it.
and
Okay.
I
Back
love your
at you.
passion. Love your passion, dear.
Me
Love it.
too. Best.
Bye, guys.